Question number 3, Simon O'Connor.
Thank you, Mr Speaker. Questions to the Minister of Health and asks, can he confirm the number of referrals from the B4 school checks for obesity-related advice and support is expected to treble as a result of the childhood obesity package announced yesterday?
Mr Speaker.
The Honourable Dr Jonathan Coleman.
Mr Speaker, yes I can. Yesterday I announced a comprehensive plan to reduce childhood obesity. At the core of the plan is a new health target for 95% of children identified as obese in the before school check to be referred to an appropriate health professional. To support this, a range of new and improved practical advice will be available for families and to assist health professionals. This new target is one of the government's 6 national health targets and means, listen to this, it's important, we are now virtually the only nation with such a target and an extensive program supporting it.
Order. Before I call for a supplementary, there's one particular interjector coming from my left that is too loud. Simon O'Connor, supplementary question.
I need a well check. Supplementary question.
Supplementary question, Simon O'Connor.
What other elements make up the government's package?
The Honourable Dr Jonathan Coleman.
Mr Speaker, there's no single solution that will fix obesity, so that's why we've developed a range of evidence-based actions which include the free health checks for children I've already mentioned, more physical education in schools, more access to sport, increased advice and stronger food labelling. Our package includes 22 initiatives involving government agencies, the private sector, communities, schools, family and whānau. There are interventions for each life stage, starting during pregnancy through to early adulthood.
Supplementary question, Sue Moroney.
Thank you, Mr Speaker. To the Minister. Does he agree with the World Health Organisation that there is a mounting body of evidence showing breastfeeding plays a role in protecting children against obesity, and therefore will he recommend support for the Labour Party's proposal to extend paid parental leave to 26 weeks so mums can aim to breastfeed to 6 months as recommended by the World Health Organisation?
The Honourable Dr Jonathan
Coleman. I agree on the first point, but the second's not necessarily related.
Order. We have a point of order on my left, which I cannot accept until this. Point of order, Sue Moroney.
Mr Speaker, I seek leave to table a document dated 2012 entitled Systematic Review and Meta-Analysis of Risk Factors for Childhood Overweight Identifiable During Infancy.
I just need whose document it is.
It's in the name. The authors are Wing, Redsall, Swift, Yang and Glazebrook.
On the basis it may not be freely available, I'll put the leave sought to table that particular document. Is there any objection? There is none. It can be tabled.
Point of order.
Point of order, Sue Moroney.
Can I seek leave to table a document entitled, dated 2009, entitled Breast Milk Hormones and Their Protective Effects on Obesity. The authors are Savino, Liguaro, Fisor and Ogero.
And is there any other documents the members seeking leave to table?
I'd also seek leave to table a document from the World Health Organisation of 25 such
World Health Organisation information will be freely available. I'll put the leave for the document first mentioned. Leave sought to table that particular document. Any objection? There is none. It can be tabled. Supplementary questions? Supplementary question, Simon O'Connor.
To the Minister, how is he bringing together sport and health to increase healthy activity amongst children?
The Honourable Dr Jonathan Coleman.
Mr Speaker, nutritional advice and support is important, but so is getting kids active. So the package contains a number of actions to be led by Sport NZ, many of which involve working alongside the Ministry of Education to reach kids in our schools. One initiative, Play.Sport, is a national approach aligned with global best practice and will improve the quality of physical education in the schools. Another initiative, Sport in Education, is an innovative approach to engaging students by placing learning in the context of sport. These are exciting initiatives which are being welcomed by school principals.
Order. Supplementary question, the Right Honourable Winston Peters.
In the light of his effusive announcement that included children being given more opportunities to be physically active, will he instruct the Northern District Health Board to reinstate the health promoting schools funding cut in June 2015 If not, why not?
The Honourable Dr Jonathan Coleman.
As the member knows, if he comes up and visits the District Health Board, it's a devolved system and they get to make choices about what is best for people in their communities. They're doing very well at that, DHB, and I trust them to make the right decision about that.
Speaker.
Point order. Point of order. The right
Mr.
honourable.
Speaker, I seek leave to table a letter dated 16 July to the Moroney School in Northland from the District Health Board outlining the cuts outlined in my question.
Leave sought to table that information. Is there any objection? There is none. It can be tabled. Further supplementaries? Question number 4, the Right Honourable Winston Peters.